Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are joined by Dr. Mallory Marshall, Assistant Professor with the University Medical Center Department of Pediatrics. And today she is going to be talking about the maltreatment of a child. Thanks for joining us today, Dr. Marshall. So what's kind of the importance behind this?
Yeah, so child maltreatment, unfortunately, is something that happens more than we would like to think. It encompasses 4 domains: child physical abuse, sexual abuse, emotional or psychological abuse, and child neglect. And then, even though it can be something uncomfortable to think about or talk about, it's really important because it affects a lot of the children in our community.
How often do you see patients like this?
So, it can be hard to know when a child has been a victim of child maltreatment. As a pediatrician, it's something that I have to consider with every family and with every child that I see. And so we're always, paying attention to signs, and whether it be the child's behavior or findings on their exam or comments that are made. So something that we're definitely always aware of, but unfortunately, sometimes not something we always know is coming through the door.
What are kind of the typical signs that you see?
So they can be really subtle. A lot of times it's, asking additional questions about things that I may see on a child's skin exam, or if I observe, interactions between a child and a caregiver in the room, kind of diving in to talk about what discipline looks like in the home, or how parents manage, challenging behaviors with their children. So different things like that, I would say.
So these signs are not just going to stand out to you necessarily.
Well, unfortunately, like with other medical conditions, child maltreatment can come in a variety of severities. So, there are those cases where the findings are very severe and obvious and things like that. But more often, I would say, it's those subtle things that you really have to be thinking about before you may find that a child has become victimized.
And going to a case that y'all have found out about, what's kind of the trajectory for them after they have been?
Yeah, so children who have been, confirmed victims of child maltreatment, there's a lot of impacts on their life, both in the immediate time setting, but also long term. One of the biggest areas where we see impacts on the child's health is in relation to mental health disorders. So children who have suffered trauma from child maltreatment commonly have increase in depressive disorders, anxiety type disorders. They can also have conduct and behavioral disorders as well. And then there's also, the effects on overall kind of risk-taking behavior that sometimes increases their risk for other health outcomes in the long term.
Absolutely. Going forward, I don't know what you would want to say to other people kind of out on the street, but going forward, professions more like you, where you see a child every single day, how should they go forward in handling a case like this?
Yes. So, like I said, realizing that unfortunately this is a reality for some of the children in our community. And so when you have that kind of feeling that something may seem off, or you're just not sure, don't shrug that off. We all, as a greater society, have a responsibility to our most vulnerable people, which are the young children. And, our evidence shows that victims of child maltreatment are usually those younger kids. So ages 5 and below are at a slightly higher risk. And a lot of times they don't have, the methods to be an advocate for themselves. So if you're in a role where you get to interact with children regularly, make sure you're thinking about this, paying attention to this, and really talking to the kids in your life about their worth and their value and how they can identify a trusted adult if something does happen, so that they know where they can go to voice concern.
Are there symptoms that you
certainly see when they come to visit you that always need to be like handled, like maybe their malnutrition or their
Are those economic size?
yeah. So one of those domains of child maltreatment is neglect, which is thought to be just the absence of meeting the child's basic needs. So sometimes that can look like lack of food or nutrition or lack of clean clothes or of affection, those types of things. It's certainly, from the medical standpoint, when we have a child who's malnourished, there are things that we can do to kind of address that and rehab that. But a lot of times too, it may not be those outward medical physical findings. It may just be more of those emotional behavioral things that we notice. Anytime there's been a drastic change in a child's demeanor or behavior, we need to ask why. I mean, children can have good days and bad days just like adults can. But if there's something, quite obvious that the child's no longer acting like themselves, we need to ask more questions.
Statistically, what does this do for the child that goes through things like this?
Yeah, so, a lot of our evidence, like I said, suggests that they do have issues long term, particularly within the world of mental health. Now, that's not to say that there are things we can do to help once that trauma has happened. There are other things that can be protective for them in the future in ways that we can address, the trauma that's happened, whether that be through counseling or through even medication sometimes. There's definitely hope and things that we can do. But the goal, I guess, for pediatricians and for the community would be to prevent the trauma and prevent the maltreatment from happening in the first place.
What do you think the biggest takeaway for this subject is?
Yeah, so the way that I like to think about it is anything within a family, a household, or a community that causes a stressful environment is going to increase the risk that a child becomes a victim of maltreatment. And so, whatever role that you may have, anything you can do to decrease the burden of stress for an individual is going to help the greater picture and, try and prevent some of that risk to the children.
So how do the public need to do this?
Yeah, so I think that can look differently for each individual. You mentioned some people have roles where they interact with children daily, whether that's other pediatricians or teachers or people involved in, youth programs and things of that nature. For those types of people, I think, building up the kids that they interact with. For others, maybe you don't have direct contact with kids on a regular basis, but advocating for policy that protects children and protects families can be a really helpful way to get involved.
Was there anything that I haven't asked you that you would just like to add?
Yes, this is one thing I would like to add. So, it's a really big deal for a child who has suffered this type of trauma to vocalize it, right? To have to say what happened. And a lot of times kids are unsure. They're unsure if they're going to get in trouble or if it's their fault. And so if you become a person that a child entrusts this information to, just remember that that was a big step for them. And it's not your job to validate those concerns or what happened, but it is your role to support that child, to believe what they're telling, and then to make those concerns known to somebody who can investigate further.
Well, thank you, Dr. Marshall, for
Yeah.
joining us today.
Of course, yes, thanks.